What is cervical corpectomy and fixation surgery? Normally, whenever there is a problem in the bone of the cervical spine, that means the vertebra of the cervical spine, this area of the spine, and the bone is destroyed or compressed beyond repair, then we do this procedure which is known as cervical corpectomy. In this, we take out the fractured or the injured part of the bone. We remove it so that the pressure from the spinal cord is removed, and we put a cage in place of it, over which to stabilize we put a plate and we fix it with screws. So normally cervical corpectomy and fixation surgery is required when the patient is having a fracture of the cervical spine or a tumor or a cancer or some sort of infection that has destroyed the bone of the cervical spine, and we need to remove that particular part of the vertebral body. Normally this procedure is done so that the pressure can be taken off from the cervical spine. This procedure is normally done through an anterior approach, that means from the front of the neck. We normally give a horizontal incision here, and through that we reach the cervical spine, we remove the broken bone and we put a cage in place of it. This cage basically acts as a spacer and we fill it with bone so that in long run it becomes strong and gets integrated into the neighboring bones, over which we put a plate and stabilize it using screws so that the overall construct becomes solid. So if you are suffering from cervical spine tuberculosis, or there is a history of cervical spine trauma or cancer or some tumor that has destroyed the bone, and your doctor has suggested you cervical spine corpectomy and fixation surgery, so don't worry. It's a safe surgery which is done using microscope and results are really good. Normally this surgery takes around 2 hours, but depending on the complexity of your pathology, it can take more or less time. So if you are suffering from cervical spine issue, don't worry. Visit your doctor, discuss out the pros and cons, and whatever is the right decision for you, your doctor will advise you. Thank you.